Hello, my name is Laura Cantrell, and I will be performing a IV STAR and a primary infusion. I will follow all GPSP guidelines, the 11 rights, the 2 patient identifiers, the 3 med checks. I will assess my patient for allergies, assess for a proper site location. My supplies is already selected here, and my area is clean. And I will begin by performing hand hygiene. I will spike my fluid bag, and prime my lines and prime my J-loop using a sepsis technique and the twist and push method. I will hang my back. I will squeeze that until the chamber is halfway full. Begin to prime my line, making sure there's no kinks in it, there's no bubbles, and there's a flow. I will hold my cap so I can put it back on there before hanging. Release. There's a good flow, no bubbles. Putting my cap back on. Hanging my solution. hanging my line. And then I am going to begin priming my J-loop. I will perform hand hygiene. Take it out of the pack. Using a sepsis technique. I will open a new alcohol pad. Scrub the hub. Attach the solution. Take the cap off. Place it back in the sterile package it came in. And then I will begin to select my vein. I will perform hand hygiene before touching my patient. Put the tourniquet on. Three to 4 inches above the site. Palpate the vein. I've selected the vein, and the location was the hand, so I will check the radial pulse. Release the tourniquet. And then I will begin to clean with a cleaning solution in a circular motion per facility protocol. Alright, now I will begin performing hand hygiene again, putting my gloves on. Alright, I will now begin to put the tourniquet on 3 to 4 inches above the site and get my needle out, and I will insert the needle in a 10 to 15 degree angle. Alright, I will take it out of the package. Being sure to not touch the site. insert in a 10 to 15 degree angle. Wait for a backlash and release the tourniquet. And I will hold the catheter in place, take out the needle, and activate the safety guard and put it in a sharp container. I will then begin to connecting the J-loop. Not touching the site. Alright. And while I am flushing, I will assess this site for redness, any kind of reactions, any swellings or abnormalities. I will pull back for a blood return and begin to flush. Okay, fluid is flushing good. I will take off the flush and begin to tape so I can secure it. To put on the Tegaderm, just right above the site, to keep it clean and sterile, no contaminations. I will peel that back off. I will tape the J-loop. Now that the J-loop is secure, I will put my name and date and label it. And then, now that I have a good IV start with no reactions, there is a flow, and I will begin to connect my line, being sure that there is no kinks. I will scrub my hub. Really well. I will connect now that it is connected. I will assess my site again and watch for a flow. No kinks. The solution looks good. Everything looks good. I will release the clamp. The flow is doing great. It's dripping. So everything is fine. So I will check for infiltration, assess my patient to the reaction, and I will immediately document and reassess my patient in a later time, and I will take off my gloves and perform hand hygiene. And I have successfully started an IV primary infusion. Thank you.